maisha ilibadilika mpaka tunaishi maisha ngumu kama jilali imetukabili sana. Ng'ombe zetu zote zilikufa, mpaka mbuzi na kondoo zote zikakufa. Tulipunguza rasho ya chakula vile tunakula, tukapunguza sasa, hata kama hata siku nyingine mpaka tunalala njaa. Tuliturudisha tukakula kwa saa 7 mpaka tunaketi mpaka saa 7 ile nyingine. Kama unaishi mbali, hiyo 2,000 unakuja nayo, unakuja kwa hospitali, alafu ile moja unanunua naye chakula, maziwa, kitu kama hiyo ya watoto.
Hospital sun sirkali len sila shida qorsuni sun nuwarge qorsway nuwerku male hospital khina le qorsi khaysin jiru qorsayun qamnu adadani toknu rafayal ag hospital nu rafago moyanu tindiyato akmale shida qorsal le amna.
We had a meeting in Marsabit and we deliberated on some few issues. I think this is just a follow-up of the meeting that we had in Marsabit. I know you visited the 4 facilities that we mentioned, which are Batanrero, Ambalo, Sololo Makutano, and Dampalapajana Health Center. The program itself is very good if implemented well, because some of these clients usually do not have the means of transport to get what they usually want to get, if it is immunization, if it is medication. Now, our facilities currently do not have essential drugs, an issue I think which is cross-cutting the whole country. Now, as per what we discussed in Marsabit, the program was asked to procure these drugs, place it in the government facilities so that these clients can benefit. But now the challenges that we have is if these clients come to this facility, they miss these drugs. As per the initial plan, they are to come to the nearby clinics. Batanrero is Moyale because the vehicle is traveling this route. But now you assisting them in transportation, giving them some bit of money for transport and also some miscellaneous things which they usually encounter on the way, it is a very good program to start.
We've been implementing a program supported and funded by the Norwegian Red Cross, Cash for Health. Majorly it has a bias to health. Normally we do cash and voucher assistance, but this time round we had to change a bit because it had a bias to health. So we also had to sensitize our enumerators, how they were going to conduct the targeting and registration, and how they were going to, adjust themselves to fit into the verification processes of ensuring that the beneficiaries who have been selected are actually people who have been enrolled in the programs. They actually do meet the criteria of pregnant and lactating mothers with malnutrition, under 5s with malnutrition, and the elderly with malnutrition cases. So the enumerators were also able to be sensitized, and we also took advantage of this session to enlighten them on the findings we had already come across, what to expect when we are going to the field to conduct the exercise. And that in itself is a plus, because then it helps build the capacity of our teams to be flexible enough to adjust to any changes in terms of the programs that we enroll as an organization.
For this project, we have taken a step further in mapping facilities, categorizing on the groups with nutritional needs. So for Marsabit, we are targeting 3 wards, that is Obu, Dukana and Laisamis. We have done inception meetings for the health sector technical working groups, and cash technical working groups, and we have cascaded it to sub-county groups. Our teams have been embarked on registration exercise, which has informed by a facility mapping and assessment in those targeted wards.
I'm a facility in charge, Dambala Fachana Health Center. At this health facility, we are giving services like curative services, preventive services, immunization, antenatal, maternity services, laboratory services, and nutritional services. The services supported by the partners at the facility. We are having outreach services which is supported by the Norwegian Red Cross. At the outreach services, we are giving integrated services like antenatal immunization and also COVID vaccination. We are having nutritional services, which the nutritional supplements we are giving supported by the Beneficiary.
Mimi nafanya kupima watoto. Manyata ni mbali kutoka Bala 7 kilometers. Nataka manyata yangu change. Manyata yao ndani wakuwe clean. Watoto wakuwe clean. Na wamama wakuwe clean. Watoto wakiwa wanaenda show watengeneze show.
I'm one of the volunteers who are trained as an enumerator for cash and voucher assistance. We are taught about the tool, the Kobo tool, which we used for targeting and registration of the beneficiaries. The target groups for this project are pregnant and lactating women with malnutrition, elderly with malnutrition, and children under 5 years with malnutrition. What I've learned in the training is that this project is different from other cash voucher assistance in that it has got restriction.
We met the target at the end of the day, the target beneficiaries that were expected to be registered. And we are really hopeful that these beneficiaries get to receive the aid intended for them, and that it changes their life, and that it is able to influence positive health-seeking behavior, which is the project's main objective.